Once upon a time, the land of the free and the home of the brave had something valuable, something everybody else in the world wanted, but nobody else had. The best healthcare system in the whole wide world. People used to come to America for healthcare, for innovative treatments and cures, and affordable expertise that they could choose from. Until one day, President Obama decided to fix something that wasn't broken. And bang, Obamacare was born. Just like that, a remarkable healthcare system, responsible for the greatest medical advances of all time, became a liberal death trap for those who thought, because President Obama promised them, that they could keep their healthcare. How wrong they were. Joining me now to discuss one of Obama's worst presidential legacies, a policy that's been bad for people, bad for healthcare, and bad for America, is medical expert, cardiologist, and author of Losing Our Way in Healthcare, The Impact of Reform, Dr. Kevin Campbell. Dr. Campbell, thanks for joining me today.
Thanks so much for having me.
Now, the Senate just approved a bill last week that would repeal much of Obamacare. The House is expected to follow this. But, of course, we know President Obama plans to veto this bill. In your opinion, how important is it that Congress continue to try to dismantle this monstrosity that's hurting our healthcare system?
It is absolutely vital that our representatives here in Washington do something to fix health care. Obamacare in its current form is absolutely unusable. It separates doctor from patient, and it really restricts the health care choice that our patients have. We're really creating two Americas, one that can afford to pay for whatever care they want, and everyone else who's going to get lumped into a substandard Obamacare.
Now, as a doctor yourself, do you think the government should be involved in any way in healthcare or medicine?
You know, I think government interference in healthcare should be minimal. I think we have to regulate to make sure that patients are kept safe and that drugs are safe to become on the market. But when you enter the patient exam room and you get yourself between doctor and patient, that's where government has stepped out of line and has limited my ability and my colleagues' ability to take care of our patients, which is our #1 job.
Right, as it should be. Now, in your opinion, what role specifically should government play? Because a lot of critics say that there needs to be some regulation, as you say. Can you give us some examples of where you think it's appropriate and helpful for government to be involved without them mandating or overtaking the industry?
You know, I think it's really important that we do have access for all Americans, but we have to do it in a fiscally responsible way that allows doctors to be doctors and patients to be patients. I think another way that the government may need to be involved is to limit malpractice claims so that doctors can do the tests and the procedures that are necessary for the patient, not the tests and the procedures that are necessary to avoid litigation. And I think that government may need to be involved in limiting the costs of prescription drugs because, as you know, pharmaceuticals are running away with new $100,000 treatments for hepatitis C and very expensive treatments for high cholesterol. And we have to do something to make this affordable.
Right. I'm glad you brought up the litigation aspect because I think that that's been something that a lot of Americans have run into, that doctors are giving them advice or recommending treatments or drugs based off of doctors' own fear about being sued rather than their true, genuine, sincere recommendation about what would be best for the patient. Have you experienced any of this yourself in your practice or seen this in other colleagues' practices?
I certainly have, particularly when patients come to the emergency room with undefined complaints. Most of these patients rack up $6,000 to $10,000 bills in the emergency room for tests they just don't need. And it's really a way for physicians who are well-meaning and want to care for the patients to protect themselves from predatory lawsuits. Until we have meaningful tort reform on the national level, this is going to continue, and this is a significant contributor to raising health care costs.